You know, given our experience and track record of helping so many kids with sensory challenges, I get the question online and in private messages on a regular basis, how on earth is a chiropractor going to help a kid with ADHD? Or how on earth are you going to help my child with anxiety or a child with autism? Well, the fact of the matter is, a chiropractor does not actually treat these things. We're not treating a symptom, we're looking at the root causes of it. And at the heart, the very heart of every single sensory challenges is a neurology, a brain that's stuck in the fight or flight spectrum, the sympathetic spectrum. This is the spectrum of spectrum challenges. And what a chiropractic does is we gently, specifically find these areas, gently adjust them so that the brain and neurology can go back towards that other side of balance, the parasympathetic boost that gets to the heart, the why behind every single neurological challenge. The answer to your child's challenges is on their insides. Their brain and neurology desperately is seeking to adapt, is seeking to heal, is seeking to develop these skills and adaptations throughout life, but somewhere along the way they got disconnected. And in many cases is at the beginning. Birth trauma puts upwards of 50 to 60 pounds of pulling with your average C-section. That's not okay. We're not just stretching muscles and ligaments, we're damaging brain stems. And if we look at the lifestyle of the average American child, yeah, it's not too healthy. We can look at physical stressors and what they're not doing with their bodies on a regular basis. They're missing out on physical milestones. They're lacking that physical touch. Chemical stressors, my God, we could spend an entire weekend listing the things that kids are exposed to in the first few weeks of their life. And then there's also emotional stressors. We live a very fast, high-paced lifestyle that just leads to disconnect and stress. And the fact of the matter is the brain and nervous system can only deal with so much before it says, I'm done, I'm overwhelmed. And the natural neurological response to overwhelm is fight or flight. The fight or flight spectrum, the very spectrum of spectrum challenges. If we can test, measure, and look at this brain and neurology from an objective perspective, taking away the emotions, taking away the fear, and looking at the facts, we can find out exactly what's going on with your child's neurology and give you a detailed blueprint and plan so that they can connect and heal on their own terms. It's your child's brain. It's their neurology that actually heals the system. We're not treating these symptoms, we're addressing the cause. And when you address the cause of anything, whether it's a physical or an emotional issue, you're going to get to the heart of healing. And that's exactly what we do right here in our practice.